Hi, thank you for tuning in. My name is Angie Madsen. I'm a trained fertility, birth, and postpartum doula for Cafe Doula in the Columbia River Gorge in Washington and Oregon. For those of you who don't know what a doula is, I like to call doulas the trail guides of reproductive journeys. They provide physical, emotional, and informational support for their clients in a compassionate and unbiased manner. Today, we're specifically talking about the postpartum or after birth period. My goal today is that by the end of this talk, you'll feel more knowledgeable and confident about the fourth trimester, so those first few months after birth. I also hope that you can use this information to help other new parents feel supported. Community is a crucial aspect of the postpartum experience that our society tends to dampen at times. So let's begin. First of all, I'd be remiss to not acknowledge COVID-19 since it affects every aspect of life. The fascinating thing to me is that over the past couple of months, the world has been experiencing what postpartum parents normally have to experience. Think about it. In the US, the culture typically leads to new parents being socially isolated, having stress, anxiety, trying to adjust to a new and dramatically different normal. Both pandemic and having a baby typically lead to messy life changes, an upheaval of the family work-life balance, and challenges to health and relationships, possibly. Both situations bring uncertainty, loss of choice or plans, worries of safety and financial stability, and even grieving missed experiences. I do think that a positive thing that could come from this pandemic is an increase in awareness that new parents deal with many of these current sentiments and stresses quite often. So others may think of new ways to support them. Plus, it could show parents the importance of preparing for the postpartum period in advance, which is even more important than ever now, since we have to get creative in terms of support from outside the household. Remember that many things that others can do to help new parents during non-pandemic times, they can still do during isolation, like dropping off food, picking up laundry, video chatting with words of support. So hopefully new parents can find a couple perks from this period of distancing, like maybe less pressure to clean, less fear of missing out, FOMO, and the excuse to focus only on nesting, resting, and bonding. Remember, babies are just babies. They don't know about pandemic, so their needs remain the same. But during a time like now, self-care for you goes back to the absolute basics like nutrition, sleep quality, exercise, rest, and creative outlets, which we'll get to. So why does a healthy fourth trimester matter? For those of you who are scientifically minded like myself, because the research says so. In May of 2018, the American College of Obstetricians and Gynecologists released a set of recommendations regarding the postpartum time. I won't bore you with the research paper details, but you can find it online. I'll share with you a few highlights here. So the weeks following birth are a critical period for a parent and their infant, setting the stage for long-term health and well-being. To optimize the health of parents and infants, postpartum care should become an ongoing process, so not just one checkup after birth, and it should be individualized to their needs. And that planning for the postpartum period should begin during pregnancy, so coming up with a postpartum care plan to help ease that transition to parenthood and taking care of your own mental and physical health. Just to reiterate, this postpartum period can set you up for years of success if you have the support of your social circles and health professionals, and if you prepare prenatally. We often say that we're expecting a baby, but we should also be preparing for a baby. On the surface, prep usually looks baby-centered, like getting the house ready, the nursery put together, shopping, but that's not enough. When you're pregnant, you need to start managing your expectations. The culture in our part of the world is all about doing and productivity and achievement, which is a huge contrast to what your new way of life will be, and the changing priorities that actually make you want to embrace nesting, resting, and bonding as your only job in the early weeks after birth. The fourth trimester isn't a great time to start training for a half marathon or remodel the kitchen. You'll want to be and not do, and get back in touch with the natural rhythms from which you're usually disconnected. Postpartum is all about getting back in touch with what your body and your baby are saying and actually listening to those signals. So those first few days and weeks, they are magical and challenging weeks. Our society often views early postpartum as a sacrifice. But can we twist that and instead treat the time as a period of discovery? It's during times of challenge when we get to discover our true selves and what we're capable of. So rather than attempt to set a schedule for those first few weeks, try to focus on discovering your baby. Tune into your baby's needs and figure out how you and your partner can cope with those needs. Tune into what makes you and your partner happy and healthy so that you can prioritize those things. And what you'll probably want to prioritize is rest. Many other cultures emphasize the importance of rest during this time. I've even heard the phrase, spend one week in the bed, 1 week on the bed, and 1 week near the bed. Giving birth is really hard work. So that first week, the in the bed week, most people who give birth can expect fatigue and will feel very worn out if they exert themselves. There's usually uterine after pains, perineum pain, especially if you tore or had an episiotomy. And if you gave birth by cesarean, you may have pain from stitches and gas. So those early emotions will be changeable and unpredictable thanks to several things: hormones, body functions, and fatigue, and possibly trauma as well. So it's normal to be very moody with emotional highs and lows. And in fact, 80% of people who give birth experience what we call the baby blues. So this means that you'll cry easily, feel overwhelmed at times, love and hate being a parent at the same time. This passes within 2 weeks, and it can be helped along by going back to those self-care basics, so sleep, nutrition, and comfort. I have some quotes from parents that have talked to me about this time. So this parent says, "I would have loved if someone would have helped with any aspect of chores and meals, at least in the very few weeks after birth." So you know how they say it takes a village to raise a child? Well, your village starts right away. So if you're giving birth somewhere outside your home, see if your friends or family can clean and prep your home while you're in labor at the hospital or birth center. Friends and family don't always offer to help because they don't know how to and they don't want to get in the way. So you'll want to keep a running list of specific tasks that close ones can help with. So shopping, laundry, cooking, cleaning, even watching baby while you nap or shower. Even during COVID-19, they can still drop off groceries, send a care package, pick up return laundry, drop off coffee, a meal, or flowers on your doorstep, maybe even gifting a 1 week of a meal kit subscription. It can go a long way. So take note on all those if you know people who are giving birth very soon, because they could use it. Everybody loves action steps, right? So here are 4 things that you can do now to prepare for the early days and weeks. First one is learning basic newborn care. So highly recommend taking a newborn care class before birth. If that's not possible though, see if your birth facility offers a crash course before you're discharged. Midwives help during a home birth. 2, set up a shareable, editable Google Doc or Google Sheet, some kind of living online document that you can keep that running list of things that you need. That way you don't have to go asking people, they don't have to come ask you, they can just check the list and help out that way. 3, try not to get carried away with buying all the stuff. You don't actually need as much as many companies will suggest that you need to have a baby. Plus, your baby might come out bigger than the clothes that you bought. So keep those receipts just in case. Number 4, possibly most important, is to set boundaries. So you might need to have tough discussions, but have them now so that you don't have to do it when your baby is here. For example, maybe you'd prefer no visitors at all for a period of time, and some people might not be happy about that. Maybe a close family member is a smoker and you don't want them coming near the baby, or maybe a close friend has strong opinions about how your baby should be fed, and those opinions differ from your own. So set the boundaries and have tough discussions now so that these people can get over it before then. Now we have physical changes. So ideally, you will have a checkup 3 or 4 days postpartum, but that's rarely offered in our society. So try to schedule an appointment soon after birth, during which your healthcare provider will check the perineum, any stitches, your vaginal flow, cesarean scar if you had one, check your breasts, and discuss birth control. Just 2 more quotes from real life parents. I knew ahead of time what to expect in general, but I was still hit hard with the physical recovery. If my mother had not visited for a week, I would have needed to go to the hospital just for physical support. And I literally would not have survived without in-home support, my mother and midwives, for the week after birth. So for non-emergencies, you can likely get help from a doula, childbirth educator, breastfeeding counselor, or other experienced parents. Most of what I list here doesn't really matter whether you gave birth by cesarean or vaginally, but specifically, cesarean births generally require a longer recovery period. The incision area will feel very sore. You'll probably want to learn special ways to sit up from your lying position and how to hold a pillow if you laugh or feel a sneeze coming. You'll want to keep an eye on the timing of your pain medication so they don't wear off. And you need to learn how to check and clean your stitches. Of course, your healthcare team will go over everything you need to know. I'm not a doctor, but a doula can help you cope physically and mentally as well. If you give birth vaginally, you may have tearing or possibly a cut by the doctor on your perineum. So you'll want to make sure you become familiar with padsicles, sit spats, and squirt bottles. Just because you don't have major surgery with a vaginal birth, it doesn't mean that you won't get exhausted. I don't know if any of you are runners like me, but going into labor, you don't really know whether you've signed up for a 10K or an Ironman, but you're gonna feel something after a human exits your body, at least for a bit. In either manner of birth, you'll likely experience these changes shown here in the first weeks postpartum. When you're not pregnant, your uterus is the size of a pear, and right after birth, it's the size of a large grapefruit. So it can take about 6 weeks to return to its normal size, which, fun fact, is a process called involution. During this time, you might feel after pains for the first few days after birth, which are healing the spot that your placenta was attached at. Lochia is vaginal bleeding. It looks like a heavy period with small clots and color changes over time, and it lasts around 6 weeks. The return of your period is unpredictable, and super important to know that you can get pregnant before having a period, since ovulation, or the release of an egg, occurs before a period does. Even if you're breastfeeding, you might still ovulate. Please talk to your healthcare provider. For breasts, mature milk will come in between the 2nd and 5th day. It might take a month to get into a good breastfeeding rhythm and feel comfortable with it. Breastfeeding is a huge topic outside the scope of this presentation, so find a consultant if you have cracked or bleeding nipples, severe pain throughout the entire feeding, or pain that lasts after about a month of nursing. Definitely make a breastfeeding basket full of snacks, a pillow, water, entertainment, because you'll be there a lot. If you don't wish to breastfeed, you'll want to ice and compress them during this time, and your doctor can help you with that. Hormones. When the placenta leaves your body, estrogen and progesterone drop rapidly, and they'll remain low until your ovaries start producing them again, at which point you could become pregnant again. Oxytocin, the feel-good hormone or the love hormone, and prolactin, the hormone for milk production, both increase during this time. Your fluids, bladder, and bowels. So during early postpartum, You'll likely urinate often, and you'll sweat heavily to lose the extra fluid that you retained during pregnancy. But for a few days after birth, you might actually have trouble peeing due to your bladder's physical experience of birth, or even a fear of urinating due to perineal pain. So get the squirt bottle ready. Hemorrhoids are common. They usually go away within a month. For comfort in the meantime, you can use a rolled up towel to make a donut pillow to sit on. And although constipation is common for a week or two, try to avoid it by filling up on fiber, staying hydrated. See if your doctor wants you to take a stool softener. Personally, I am quite fascinated by the pelvic floor, and although it's not quite mainstream yet, going to a physical therapist who specializes in the pelvic floor is so valuable for many people. It can take around 6 weeks for these muscles to regain strength and tone, and if they're out of balance, it can lead to a lot of issues. Just because I believe so much in the power of pelvic floor therapy, one tip that I have is that when you are cleared to do your pelvic floor exercises, come up with a prompt to remind you to do them. So maybe whenever your hands are in water, like you're doing dishes or bathing baby, or whenever you change a diaper, whenever you stop at a red light or scroll on Facebook. It's easy to forget to do these important exercises unless you create a habit. Physical challenges, I'm not going to go into these because A, I'm not a doctor, and B, I babble so much that this could turn into a whole day. So here are some physical issues that you should absolutely ask your healthcare provider about if you experience them. Remember that physical conditions can also contribute to depression, so it's important to get them figured out early. Fatigue, so let alone the physical recovery of birth, babies also have 8 to 18 feedings per day, 6 to 8 wet diapers a day, and 4 poops a day, all on their own schedule. So both the person who gave birth and the partner are likely to experience fatigue. Fatigue makes everything worse, and adequate rest makes everything better. Everything. So appetite, mood, relationships, milk supply, patience. Yet people simply accept the idea that new parents can't possibly get enough sleep, right? That's not true. It can be done as long as you prioritize rest right under baby care and by strategically structuring your life. So unplugging the phone, putting a sign on the door, drawing that boundary of having no visitors or appointments before noon or a certain time. The household has to adjust to the baby, not vice versa. So just to touch on sleep, you know how they say sleep when the baby sleeps? That probably won't work. So instead, think about how much sleep you typically need in your normal life every night. Then make it a goal to get that total amount in smaller chunks throughout the day. If you typically need 8 hours of sleep to function well, you might replace that with 4 chunks of 2 hours of sleep. I mean, it's not going to come out that even, but you're working towards it. Remember, that means prioritizing sleep over doing dishes or laundry. Just do the absolute bare minimum of chores that you need to do to keep your sanity. Don't get up at just a certain time of day unless you've met your goal of chunks of rest. If you have a partner who's available, you can consider scheduling parenting shifts. Also, in the first weeks, parents usually sleep more if the baby's in the same room. If you have older kids, it is hard. Your best chance is to have someone watch them while you nap. And all this to say, getting adequate rest is hard, but it can be done and it's totally worth it. And this is a temporary period. This parent says that breastfeeding was much harder than expected. I wish I had collected resources and phone numbers for help before a baby was born, which brings me to these action steps. So here are tasks you can do now before baby arrives to make your life easier physically during the postpartum period. So 1, make a list of professionals who can help you that you might need. So names and contact info. You might not end up needing them all, but it's a lot easier to make the list now than to scramble in a search later. 2, stockpile food. You probably won't have the energy or time to cook intensive meals in the early weeks, but if you slowly start now, you can prep freezer-friendly meals or look into other options. Lots of nutrition will only help you postpartum. And 3, plan the delegation of tasks. So remember, your only job during early postpartum is to care for yourself and your baby. Think of all the little or big tasks that you ordinarily do and see if you can assign all of them to other people, at least as many as possible. So emotional and mental health challenges is ridiculously important to be familiar with, yet not always discussed. Postpartum mood disorders affect 20% of people who give birth, and even 10% of partners develop one. They can start during pregnancy, anytime in the first year, or when you stop breastfeeding. We mentioned the baby blues earlier. Those are normal, typical, they pass quickly, and they don't require additional care. However, actual mood disorders do require professional help. As this parent put it, I wish I had understood the gravity of postpartum depression and postpartum anxiety and had a plan. I expected to have neither, and I have both. So I definitely recommend familiarizing yourself with mood disorders now so that you know when to consider talking to a doctor. Postpartum anxiety and panic disorder is found in 10% of people who give birth. There's an increased risk for those with a personal or family history of anxiety disorder. It presents as the usual anxiety symptoms, plus a fear of dying or baby dying, being alone, or leaving home. Postpartum obsessive compulsive disorder affects 3 to 5% of those who give birth. It presents as uncontrollable thoughts and compulsive rituals to protect baby, and it interferes with your daily life, as these all do. Postpartum depression affects 10 to 20% of people who give birth. It's so common, yet often a taboo topic. You have an increased risk if you have a personal or family history of depression. The onset is usually 6 weeks to 6 months postpartum, but it can start anywhere from 2 weeks to 1 year postpartum. The symptoms vary, but can include feeling hopelessness, despair, feelings of extreme inadequacy, low self-esteem, a lack of energy and interest, constant crying, anger outbursts, and thoughts of self-harm or harming the baby. Postpartum psychosis is extremely rare, but extremely serious at 0.01% of people who give birth. It presents with severe agitation, mood swings, depression, and most importantly, delusions. It requires immediate medical care and hospitalization. You can also get postpartum post-traumatic stress disorder after a difficult or frightening birth or some kind of traumatic situation around the birth. This can show as preoccupation, flashbacks, panic attacks, anger, or extreme protectiveness of the baby. Risk factors for any PPMD include a history of mental health challenges personally or in your family, challenges with fertility, menstruation, pregnancy, birth, or baby, personal temperament, recent stressful life events, a general lack of support, and current physical health issues. If you have any of those risk factors, check with your healthcare provider prenatally, so now, so that you can have a game plan. PPMDs can happen to anyone, and they're not anyone's fault. If you need medication, very often meds are compatible with breastfeeding. Counseling is also very helpful, whether you're taking medication or not. This parent says that the devastating loss of alone time to an introvert like myself was a major surprise to me. Logically, I knew I wouldn't have as much alone time, but I never would have guessed it'd affect me as extremely as it did. So remember, it's healthy to acknowledge these feelings that arise postpartum. Don't ignore or deny them, because when it comes to grief and stress, they say that you need to feel it to heal it. Your body symptoms are telling you to create the stress cycle. A good cry or some other release of feelings is healthy and normal. So one way that you can tune into what you need each day and to complete this stress cycle is using the EMBODY acronym for self-care. Exercise, meditation, breathing, outdoors time, dumping, so whether that's therapy, a support group, or even journaling, and yoga. There are plenty of free postnatal yoga videos on YouTube. So this acronym can help you both with preventative self-care measures and as a treatment. So depending on what your mind and your body are attracted to on a certain day, try to get in at least one of these elements in every single day postpartum. And you can ask yourself questions like at the bottom of this slide to try and tune into what you need. So even more action steps. 1, learn and know the signs of PPMDs and talk to a healthcare provider if necessary. I can't stress that enough. 2, make a feel-good list. So come up with maybe 20 easy things that you can do for self-care during the postpartum period. These can be reading, taking a bath, watching a sports game, crafting or building, looking at photo albums, drinking a latte, video chatting with a faraway friend, whatever feels good to you. And if you're nervous about feeling isolated at home, since we've all felt that a bit lately, you can plan to break up the monotony by coming up now with ideas of short trips out of the house with your baby. You'll want to consider factors like parking, sidewalks, and weather options. So relationships, this is for those of you who are parenting with a partner. The #1 takeaway is that working on your relationship before baby is the factor that is most likely to help your relationship after baby. Postpartum will be more difficult if there are unresolved issues in your relationship, and it's challenging to nurture your relationship when your baby's taking up so much of your time. Your relationship is going to change, but you can help it be a positive change over time. First, manage your expectations of each other, yourselves, your baby, your life with your baby. So don't expect any of those to be perfect, and don't assume that any of it will remain the same. For example, if any of you are familiar with the 5 love languages, even your love language may shift. You might not notice it, but it would be very helpful for your partner to recognize that shift and respond accordingly. You might lose interest temporarily or long-term in hobbies that you used to have before baby, both solo and as a couple. The more you're open to the possibility of change, both between partners and with yourself, the more at peace you'll feel during this time. During all periods of change, communication and effective conflict management are crucial. I statements might sound cheesy, but they do work. I highly recommend looking up the book and website called Nonviolent Communication, since it can help you with all relationships in your life, especially during postpartum. Avoid blaming. Remember that the only thing we can truly control are our responses, and you can handle conflict more easily when you get adequate self-care. And finally, no shame in the therapy game. So even if one spouse refuses counseling, the other can still go themselves and benefit from it. Talk to your healthcare provider about having sex again after baby. There's no right time since it differs person to person, couple to couple. Healthcare providers usually say to wait until your stitches are healed and lochia is almost gone. Again, you talk to your doctor. I am not a doctor. But one of you in the relationship may not feel emotionally ready, even if you are physically. So talk about it together and be kind and patient. You can still show your love in ordinary moments by sitting with each other, holding hands. Most importantly is actively listening when the other is talking. So here are a few things that partners can do now to set a foundation for their postpartum relationship. At-home dates, shouldn't we all be pros at this now after social distancing? So it could look like a movie night, fondue dinner, an art project like those step-by-step watercolor paintings, at-home spa day. Just get creative. 2, write lists to each other about how your partner can show that they care about you, and then trade lists or hang them up so that you can reference them when needed. And 3, have a short list of people who you trust with your baby so that you can grab an hour away from time to time. Start small and short and have the person in your baby bond first. Oh, my favorite part, postpartum doulas. So postpartum doulas are trained in physical and emotional recovery from birth, baby-parent bonding, and basic newborn care. They nurture the entire family as they transition into life with a newborn. And doulas have the goal of working themselves out of a job by leaving parents feeling more comfortable in their roles after the doula leaves. This parent says, I think there are a lot of resources for how to care for baby, but not for yourself. I would agree. A postpartum doula differs from a baby nurse or a nanny. They're often said to parent the parent. So they take care of you so that you can take care of your baby. A normal visitor might come by just to see your new baby, whereas a doula comes by to get done what you need to get done. Though, of course, we love to see your baby too. Typically, doulas come for a scheduled shift, so usually for a few hours on certain days per week. It's really all based on what the parent needs. Your experience as a postpartum doula varies based on what you and your family want and need, but here are some possibilities of what that looks like. So we have recovery, both emotional and physical, baby care, and household tasks. Tons of bullet points that show things that postpartum doulas may help you with. Again, it's so individualized, but obviously all of these are super helpful. Also, some doulas are experts on certain topics. For example, they could be a certified lactation consultant or are great at baby-proofing homes. I myself am a Red Cross instructor for first aid and CPR AED, including for infants. My website also has a list of other community resources in the Gorge area that you might find helpful, such as breastfeeding support, chiropractic care, even newborn photography. To sum this all up, life won't go back to normal after you have your baby, but you'll discover that new normal. Many new parents find that this might take around 6 months. There are ways that you can prepare for this wonderful and huge life transition long before your baby arrives. So craft a postpartum plan now. I have a template for a postpartum plan on my website at cascademountaindoula.com. And if you hire a birth doula, they should be able to help you prepare before the birth as well for the postpartum time. Thanks for sticking around. This is my virtual business card. I recently added a Facebook page to it because people told me Facebook isn't actually dead like I thought it was. So I'm on Instagram, Facebook. I have phone number, website, and email. I would love to chat about anything if you want to contact me. I really love this community and I want to find ways to help those who live in it. Always happy to collaborate. If any of you are going to have a baby soon, I hope that you can get all the support you need and more. And feel free to reach out anytime. Thank you.